Just this past May 2020, the U.S. CDC published in the medical journal that they produce some pretty interesting information about face mask use by the general public during a pandemic. Now, you've all seen YouTube videos that talk about COVID-19. Right below the video, YouTube will put a tag and a link to this US CDC for further information because that's supposedly the gold standard for COVID-19 information, at least according to YouTube. Well, it's pretty interesting what came out in a CDC publication this past May regarding face mask use. Now, I have to be pretty careful about how I word this because otherwise I'll be deleted, or this video will be deleted from YouTube for, quote, violating community standards. In other words, telling the truth and reporting on an actual news topic from a CDC journal. YouTube is going to have a conundrum here because at the one hand, they want you to go to the CDC for all of your COVID-19 information. And on the other hand, they want to continue to prop up the face mask mandates and use the CDC guidance to support that position. However, some pretty interesting information was revealed in their publication back in May. I'm Dave DeShan, editor and publisher of the Fort Fairfield Journal. Now let's take a look at what this report published in the CDC's own medical journal has to say about hand washing, respiratory etiquette, face masks, and other things related to preventative measures for viral spread during a disease pandemic. What I'm showing you now is a screenshot to the CDC's website for their medical journal, Emerging Infectious Diseases. And here is the link to this particular report, should you want to go and check it out for yourself. So reading from the report, and I'm just going to scan through and I'm going to give you a few highlights. The report was done by a group of researchers at Hong Kong University. Now, I've received some criticism from some people already saying, well, that's written by Chinese and you can't really trust those idiots anyway. I have to remind you that this is a peer-reviewed report that had to be vetted by the CDC's staff at their publication Emerging Infectious Diseases, and it had to be approved. And all this report is doing is like it's called a meta-analysis. They're taking a look at past research, past randomized controlled trials on various preventative measures for viral spread, and they're just reporting what those trials have found. So this isn't a new trial. It is a, let's call it an anthology or a collection, a synopsis of all of the past trials. So what these report authors did was they researched something like 4 of the major medical journal search engines that are out there. And they explain their process in this report. You can go and look it up for yourself. And they found 10 reports that have to do with face masks for the prevention of viral spread. And they discuss what they found out about those. They also found 12 reports regarding hand hygiene. That is, wash your hands every 15 minutes and wash them for 20 seconds. I don't know, whatever all of the hype and hoopla and hysteria being promoted is today on hand washing. And they've discussed their findings on hand washing as well. They also have found 3 reports on surface and object cleaning and discussed their findings there. So let's take a look at what these researchers at Hong Kong University, being published in a CDC medical journal. I'm sorry if I have to keep repeating that, but I want to just keep reminding you this is a report that was authorized and approved by CDC staff to be published in their own medical journal in May of 2020. Now, what these researchers found and reported in their report that the CDC approved could be construed as anti-face mask hysteria. I just heard a newscast today where they used that term, anti-face mask hysteria. So could this report be labeled as anti-face mask hysteria? I'll read what they had to say and what they found, and you can decide for yourself. On page 971, we'll put it up here on the screen for you. On page 971 of that report, the researchers state, quote, disposable medical masks also known as surgical masks, are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. There is limited evidence for their effectiveness in preventing influenza virus transmission, either when worn by the infected person for source control or when worn by uninfected persons to reduce exposure. Our systematic review found no significant effect of face masks on transmission of laboratory-confirmed influenza. While influenza is a virus, just like the COVID-19 coronavirus, this report looked at past RCTs, or randomized controlled trials, that dealt with the spread of influenza and how face masks were or were not effective at slowing that spread. And the only reason they were looking at influenza is it's a pretty common respiratory disease, and at the time these reports were written, there was no COVID-19 in existence yet. It wasn't in circulation. They looked at reports from 1946 through 2018. And of course, there wasn't any COVID-19, so they focused on, will face masks protect the wearer from catching influenza or from his peers out in public from catching it from him. They found, as I said, our systematic review found no significant effect of face masks on transmission of laboratory-confirmed influenza. So you can do with that information what you like. YouTube, I'm sure, doesn't like it because it conflicts with the CDC's own guidance on face masks, but this is in a CDC publication. So if the CDC is the gold standard according to YouTube, then we've got to cite the CDC, and that's exactly what we're doing here. Now, the N95 respirators that we hear a lot about, those are a little more effective at viral control and stopping the spread of viruses. And that's what this report has to say about those N95 respirators. Is also pretty interesting. They said, "We did not consider the use of respirators in the community. Respirators are tight-fitting masks that can protect the wearer from fine particles and should provide better protection against influenza viral exposures when properly worn because of higher filtration efficiency. However, respirators such as N95 and P2 masks work best when they are fit tested, and these masks will be in limited supply during the next pandemic. These specialist devices should be reserved for use in healthcare settings or in special subpopulations such as immunocompromised persons in the community, first responders, and those performing other critical community functions as supplies permit." Well, they're right. During a pandemic, those N95 respirators will be in short supply, and in this most recent one, they are in short supply. There are healthcare providers here in Maine, where I'm at, where they're talking about having to use the same N95 respirator all day long, going from one room to the next, one infected patient into a non-infected patient's room, because there's not enough N95s to do proper hospital protocol, which is wear the mask into an infected room, and when you leave, you discard it into a biohazard waste bin so that the disease doesn't spread throughout the hospital or the nursing home. But now they're being told that that protocol no longer applies. We have limited supplies, therefore wear the same mask all day in infected rooms and then into non-infected rooms, and potentially spreading that virus all around. And they're forced to do it this way because there aren't enough N95 respirators. Now, that problem is slowly beginning to be rectified, but overall that's been an issue, not just here in Maine, but everywhere in the country, as there weren't enough of these N95 respirators around because everybody went and bought them. And then most of the people in the general public don't wear them properly anyway. They don't discard them properly, so they're essentially it's a tool that's being wasted because it's not being used correctly. And the people who do know how to use them correctly don't have enough of them. So that's why the World Health Organization and even the CDC authorized report in the CDC Medical Journal, Emerging Infectious Diseases, states, we should reserve these N95s for the healthcare community because they're the ones who need the most. They're the ones who are under the most extensive viral load. You will have a much higher viral load in a hospital full of COVID-19 patients than you will going to a grocery store and be in there for 5 or 10 minutes and then out, and maybe somebody is infected, maybe they're not. About wearing N95s in a grocery store situation just isn't an efficient or practical use of that tool for the prevention or preventing the spread of COVID-19, because the viral load inside of a grocery store or department store is just so much lower than what's going on inside of a hospital. That's why the CDC and the World Health Organization really would like to see you limit the use of N95s to healthcare providers who really do need them. So this report essentially says the influenza virus, it doesn't matter if you're wearing a face mask or not. And they're talking about those flimsy, disposable, surgical face masks. Okay, they're not talking about N95s. They're talking about the disposable face masks. Here's a label from one of those face mask packages. Okay, I'm going to put this up on the screen so that you can see it better. But what it basically says is this is a anti-dust breathable disposable ear loop mask, and that it has not been tested or rated and is not suggested for medical use. And also, as a caveat, I might add, it's made in China. So this is what we have been told to wear, these flimsy, disposable surgical masks, but yet this report in Emerging Infectious Diseases essentially says these masks don't protect the wearer at all. They also discuss cloth masks, and other reports have gone further into those homemade cloth and bandana, cowboy bandana masks that a lot of people are wearing. Those are actually even worse than the surgical masks because they have even less filtration capability. And I think some of them have found that they have almost zero filtration and capability. And that's because the pores in the cloth are so large that they just don't filter anything coming out of them at all, and nor were they ever intended to be a filter. So the cloth face masks really don't work that well either. That isn't me. That's the medical reports stating that. Okay, so what else did they reveal in emerging infectious diseases? This group of researchers looked at hand washing. Over here on page 969 of Emerging Infectious Diseases, volume 26, number 5, May 2020, which is a cdc.gov publication, the researchers found results from our meta-analysis on randomized controlled trials, or RCTs, did not provide evidence to support a protective effect of hand hygiene against transmission of laboratory-confirmed influenza. So that means all of those hand washing things that they're making you go through, they found that didn't stop the transmission of influenza or any other respiratory disease for that matter, because it's a respiratory disease. It's in the air. They did say that, granted, yeah, washing your hands is a good idea. You should do it. But as far as stopping the spread of a respiratory virus, the researchers found no evidence that hand washing does that. Now, flipping forward a little bit further into this report that we're reading from, again, it's Emerging Infectious Diseases is the name of the publication. It's a CDC publication, so YouTube reviewers, before you delete it, this is a CDC publication. This isn't crack conspiracy theorists. This is a bona fide medical journal produced by the CDC. The report here discusses surface and object cleaning, running around cleaning up all the shopping carts and cleaning up all of the door handles and spraying bleach on everything. This is what they found for those measures. They said, but this intervention was not significant in reducing detection of influenza virus, and it had no major protective effect on acute respiratory illness. Furthermore, they also found a cross-sectional study that passive contact with bleach was associated with a major increase in self-reported influenza. Well, that could be influenza-like illnesses. I'm just speculating here, but when you breathe in a lot of bleach, it's going to irritate your nasal passages, it's going to irritate your throat, and you're going to be coughing, and you're going to be sneezing, and you're going to be, sniffling. So lots of exposure to lots of bleach over a long period of time, they found did increase self-reported influenza, or what people believed was influenza. Now, how about respiratory etiquette? Respiratory etiquette is when you sneeze, cover your mouth, or sneeze or cough into your elbow. Okay, that's supposed to stop all the droplets from going out into the air. Okay, and I'm sure it does. There have been plenty of demonstrations that show that those droplets can be stopped not only by face masks, but also by coughing or sneezing into your elbow or covering your mouth with tissue or whatever. Okay, that's not what's being discussed here. What's being discussed here is whether or not there's any evidence that after you've done that coughing or sneezing appropriately, does that stop the spread of the virus? Well, what these reporters found is respiratory etiquette is often listed as a preventative measure for respiratory infections. However, there is a lack of scientific evidence to support this measure. Whether respiratory etiquette is an effective non-pharmaceutical intervention in preventing influenza virus transmission remains questionable and worthy of further research. So right now, we're basing all of our protocols for dealing with a viral outbreak, a respiratory virus outbreak really, on actions and on procedures that either have no scientific evidence to support them or still need more study in order to verify that they do in fact work. So what I guess we're asking here is how is YouTube going to handle promoting the CDC as the end-all be-all for information on COVID-19 and pointing to the CDC for face mask use? And yes, the CDC is recommending when you can't social distance to go ahead and wear a face mask. And it's usually those flimsy surgical disposable masks or the cloth face masks, or some states are even saying wear a bandana over your face. That's okay too. None of that's supported by the science. However, when the CDC turns around and in their own medical journal, Emerging Infectious Diseases, publishes a report that basically finds no evidence, no scientific evidence that any of these measures work, we just don't know what YouTube can do with that information, because it's a conundrum for them, really, isn't it? It's the CDC saying, yes, wear face masks, they stop the spread, but then it's the CDC authorizing a report to be published in their own journal of medicine that essentially states we don't have any scientific evidence that that works. So it remains to be seen how YouTube's going to treat this video and others like it, and if this website link even stays active. It's active as of the time that I've posted this video, but it will remain to be seen if it will stay active. So what I suggest is everyone who goes to it take advantage of the ability to download the PDF file of that report. It's a copy right out of their magazine. Okay, it's 27 pages long if you want to download the appendix, which I suggest you do too, because the researchers footnote and hyperlink all of the reports, all of the randomized controlled trials that they used to come to their conclusions, which you can then go and research, as long as those don't fall into the Orwellian memory hole either. Well, that's my report for today on the CDC's position on face masks and the report that they recently authorized to be published in their own medical journal. So here are the links again. I'm going to put them up on the screen. Get busy. Go there, download the PDFs, archive this information, do screenshots if you have to, and make sure this information gets preserved before it gets deleted from society. Thank you.